Here I am showing the malleable penile prosthesis that is used for erectile dysfunction. I have other videos talking about the pros and cons of the malleable, but this video is mainly just to show you what the device actually looks like. There's two cylinders, one that goes in each side of the penis. It's a simple device. There's no fluids, there's no buttons, no tubing. It's pretty simple to place surgically, typically takes less than an hour. The devices come in three different widths in terms of the diameter of the cylinders, 9.5 millimeters, 11 millimeters, or 13 millimeters. 90% of the time we use the 11 millimeter device, and it's 11 millimeters on each side. And the length, you can see here, there's numbers showing the length of the device. So during the surgery, we measure how big the space is from the tip of the penis down to the bone. And it's really hard to predict, actually, because you can't tell how deep somebody's bone is. You only see the outside of the penis. But once we get that measurement, then we cut it according to the line here, how many centimeters long it's going to be. So it's sort of, each one is a custom fit in terms of the length. And then once we cut it, let's just say this guy had 24 centimeters, so we wouldn't have to cut it at all. Then we would just take this little rear tip that goes so that the bottom is not this blunt component. It just makes it a little bit more easy to place. And we basically just put this in on one side and put the other one in on the other side. And so the nice thing is that it's very easy for the patient to use. The downside is that it's not quite as natural. So when the patient is just walking around, not having any sort of intercourse, they just sort of bend it out of the way. So the penis is never really soft. It's just sort of bent and out of the way. Now, patients don't really complain that it causes any discomfort or that anybody can see it underneath their clothes, but it's just not quite as natural. Your penis is never really soft. It's just sort of bent. And then the other issue is that when you do straighten it out and it's time to use it, it is rigid enough to penetrate. This is the most common type of implant placed worldwide, so it gets the job done. But it's not for lifting weights. You know, this thing is not going to be super strong like an inflatable one will be. But with these two cylinders basically right next to each other, and a little bit of the natural structure and engorgement of the patient's penis that's still there, this has enough rigidity that it can penetrate. But again, if you were to do, something with really a lot of force, it will buckle. So it's the simplest way to get the job done. It has its disadvantages for sure, but it is the right implant for the right patient, and it's underutilized and not considered for a lot of patients. And I think it should be at least discussed with patients that this is the simplest option for surgically correcting erectile dysfunction.